All right, let's dive into the simple yet revolutionary set of rules that dragged surgery out of the Dark Ages. We're talking about the code that turned a terrifying, bloody gamble into the precise science that saves lives today. I know, that's a pretty intense question, but you have to understand, a little over a century ago, the line between the two was, well, it was terrifyingly thin. Speed was the name of the game because it meant less agony for the patient, but it also meant trauma. It meant infection, and it meant a whole lot of uncontrolled bleeding. So what on earth changed all that? What was the big turning point? Believe it or not, the answer wasn't some miracle drug or a fancy new machine. It was this, a simple, almost elegant set of principles, all laid down by just one visionary surgeon. And that surgeon was Dr. William Halstead. His ideas, born in the late 1800s, became the absolute bedrock of basically every single operation that's performed today. You can think of them as the unspoken vows every surgeon takes before they even pick up a scalpel. So here they are, the 8 tenets. They might look kind of straightforward to us now, but trust me, each one of these was a game-changing solution to a really deadly problem. To really get why they're so powerful, we're going to break them down into a few groups, starting with how Halstead changed the entire field of surgery itself. So the first huge shift was really a change in philosophy. Halstead basically argued that a surgeon's hands shouldn't be weapons used against the body, but instead they should be delicate tools working with it. It was all about finesse over brute force. And just look at the difference here. Before Halstead, it was all about speed. Surgeons would just power through, using blunt tools, ripping and cutting straight through muscle, causing a ton of trauma. Halstead's way? It was completely different. It demanded that surgeons know anatomy inside and out, so they could gently separate muscle fibers, carefully move nerves out of the way, and basically treat the human body with the respect it deserves. This one change alone prevented so much unnecessary damage and made healing way, way better. Okay, so once Halstead changed the physical approach, he went after the two things that killed most patients, even when the surgery itself went perfectly. Those invisible germs and, of course, unstoppable bleeding. You have to realize, before a sepsis, getting an infection after surgery wasn't just a risk, it was pretty much a guarantee. Germs were literally everywhere. So Halstead's radical idea of total sterility, from the tools to the room to the surgeon's own hands, is what single-handedly turned the operating room from a death trap into a sanctuary. And then you had the problem of blood. Before Halstead, trying to control bleeding was just this desperate, chaotic battle at the end of a procedure. His fourth rule completely changed that. It made controlling bleeding a top priority, every second of the way. By carefully managing every tiny blood vessel at every stage, surgeons could finally do longer, much more complicated operations without the patient, bleeding to death. But here's where Halstead's genius gets even more impressive. He didn't stop when the main part of the surgery was done. He knew that how you close the wound is just as crucial as how you open it. And this led him to discover a hidden enemy that could ruin a perfect surgery. He called this enemy dead space. So, what exactly is it? Well, it's pretty much what it sounds like. Imagine a surgeon removes a tumor. They're often left with an empty pocket inside the body. If you just stitch up the scan on top of that gap, you've created this unseen void right under the surface. And here's why that is so dangerous. That empty space, it fills up with blood and other fluids almost immediately, and that creates the perfect, warm, soupy environment for bacteria to just go nuts and multiply. Halstead's fifth rule, the obliteration of dead space, meant that surgeons had to meticulously stitch those internal pockets closed, preventing a nasty, hidden infection from ever starting. This exact same logic applies to the stitches themselves. I mean, you'd think you'd want to tie sutures as tightly as you possibly can, right? Makes sense. But Halstead proved that's a huge mistake. Tying a suture too tight literally strangles the tissue. It cuts off the blood supply and kills the very cells you're trying to help heal. His rule was brilliant in its simplicity. Use the absolute minimum amount of suture material you need and close the wound without any tension. That lets the blood flow, and it lets the body do its amazing healing work. And that brings us to the final rule, immobilization. This is probably the most straightforward one of them all, but it's just as important. A healing wound needs to rest. Simple as that. Whether it's a cast, a bandage, or just some tape, keeping the area from moving around gives the body the stable, calm environment it needs to repair itself. So, when you take all 8 of these principles and you put them together, what do you really get? You get the entire foundation of modern surgery. What Halstead did was take this brutal, high-stakes art form, one that was all about speed and sheer strength, and he turned it into a meticulous, controlled, and predictable science. His tenets are the invisible contract of trust between you and your surgeon every single time.
Which, of course, leaves us with a really fascinating question to think about. Halstead's rules have held up for more than a century. But now, as we're heading into this crazy new era of robotic surgery, AI, and genetic medicine, what's going to be the ninth tenet? What's the next revolutionary rule that will define surgery for the next 100 years?